Hi, my name is Miriam. I'm going to be your nurse practitioner for today. I will be assessing your HEENT and respiratory. I have just washed my hands. What is your name?
Leah.
Okay, can I start the assessment?
Yes.
Okay, I will begin with inspecting the head for lumps, lesions, masses, hair pattern distribution. Okay, everything appears normal. Head is normal cephalic, contour is symmetrical, and I will begin palpating the head. No masses, no lesions. Hair is thick, no signs of thinning. Okay, no scales noted. Okay, now I will start with the eyes. We will begin with a visual acuity test using the Rosenbaum card. If you can hold it 14 inches away from your face and start with covering your one eye and start reading from the top to the bottom as far as you can.
A, B, C, D.
Okay, and now with the other hand, 14 inches away.
A, B, C, D.
Okay, your vision is 20 out of 20. And now I will start inspecting your eyes, your eyebrows, and the position of your eyes, which is symmetrical. No ocular swelling noted. Shape is normal. The medial and lateral canthus looks normal, and the lacrimal ducts are normal and intact. Okay. And now we're gonna pull down the lower eyelid and check the conjunctiva for any drainage. No redness noted. And now I will pull up the upper eyelid to check the sclera, which looks white. The cornea and iris look normal in shape and size, as well as the pupils. Okay. Now I will check for direct and consensual papular light reflex. So I will turn my pen light on. I will dim the room and have you look straight ahead. Okay? I will move the pen into one eye and both pupils should constrict. And when I move the light away, your pupils should dilate. Okay? And now we will do the accommodation test. So I will move the pen inwards. Focus on the pen. As I move it forward, the pupil should constrict, and as I move it further away, they should dilate. Okay, now we'll do the confrontation test. Can you cover your eye? Okay, and this will check for peripheral vision. Please tell me when you see my fingers.
I see it.
Okay.
Yes.
Okay, now the other eye.
Yes. Yes.
Okay, and now we will check the extraocular movements. Please focus your head on my finger and follow the pen light with just your eyes. Okay, we are looking for nystagmus and parallel movements of your eyes. Okay, everything looks normal. I will now use the ophthalmoscope to perform the eye exam. We are looking for the red light reflex in both eyes, which is a normal finding. And now I will look for the optic disc following the blood vessels. Optic disc is orange-red in color, and the blood vessels are located in both eyes. And then we will move on to the nose. The nose is a midline. Inspecting it, it's symmetrical and midline. I will be palpating it for tenderness, and I will also palpate the maxillary and frontal sinuses. No tenderness noted. I will now take the speculum and look inside the nose. Gently pull your nose backward and check for any masses, any obstruction. It looks pink in color, fine hair, no mucus drainage or any deviation. Okay, and now we're gonna move down to the lips. I'm gonna inspect the lips for swelling, dryness, color is pink, no cyanosis noted. Okay, now can you please open your mouth? Okay, no dental caries, no discoloration. Buccal mucosa is moist, pink. The palate is discoloration. Gums are clear, no discoloration. Can you please say on and stick out your tongue? Okay, I'm looking for the tonsils. No inflammation, the uvula rises. No white streaks noted. Okay, can you lift your tongue up, please? Checking underneath. Can you lift it down now? Can you put it down, please? And then move it side to side. Okay. Okay. Yes, I checked the soft palate and the hard palate as well. Okay. Everything is clear, pink, and moist. Okay, and now I will inspect for the ears. The ears are symmetrical, not too large, not too big, not too small. No lesions, no bumps or swelling noted. Okay, now I will palpate the mastoid process for any tenderness. Do you feel any pain?
No.
Okay. Now I will do an internal examination of your eye by pulling the auricle up and back, and I will check for any erythema, no discoloration noted, no cerumen, no discharge. I have identified the cone of lay and the malleus, which is gray, okay, as well as the paraflacida. No scarring or perforation noted. Okay, now I will check your gross hearing test by rubbing my fingers together. So please close one ear, and I'll be 4 inches away. Tell me if you hear.
Yes.
Okay, now the other side.
Yes.
Okay. Now I will do the Weber test. I will bang this and put it at the top of your head, and you will tell me if you hear and feel the vibration. Do you feel it and hear it bilaterally?
Yes.
Okay. And now we will. Bilateral is normal. Unilateral would be abnormal, and now we will do the Ryan test. Sorry. Okay, now please tell me when you stop hearing the vibration.
Okay.
Okay. And now tell me when you stop hearing it. We are checking for air conduction versus bone conduction, and the air conduction should be greater than bone conduction, which is a normal finding. Okay. Now we're gonna move on to the neck. Neck is symmetrical. Trachea appears to be midline, no deviation, no masses. Okay. I'm palpating for the lymph nodes, checking for the periocular lymph nodes, postauricular, occipital, tonsillar, submandibular, submental, superficial, cervical chain, deep cervical chain, posterior cervical chain, and the supraclavicular nodes. Okay. I will now palpate your thyroid from a posterior approach. Please lift your head up. Okay. And I will place my fingers on your neck. If you can swallow for me. Okay, no enlargement, deviation, or inflammation noted. Okay, now we're going to start the chest from a posterior. I will jake the patient for privacy. Patient is sitting upright, and we're going to start inspecting. I will estimate the AP to lateral chest, which is 15 millimeters, which is considered normal. I'm inspecting for any skin abnormalities. Rate and rhythm appear normal. Respirations are normal. No retractions or bulging. No shortness of breath. Okay, normal breathing pattern. Now I will start I will be palpating for masses. No masses noted. No tenderness. Okay, I will assess for expansion. I will place it at the bottom of the rib cage. Can you please take a deep breath in and out? rib cage expansion is symmetrical. Now I will check for tactile fremitus. Okay. Can you please say 99?
99, 99, 99, 99,
I'm feeling equal vibration.
99.
Okay, now I will start percussing. I'm looking for resonance using the Z-track method. Percussing with the Z-track. Okay, now I'll be doing the diaphragmatic excursion. Can you exhale and hold your breath? I will start percussing all the way down until I feel dullness. Okay, let the air out now. I feel dullness. I will mark it right here. Okay, and now take a deep breath in. And I will do the same thing. I will percuss until I hear dullness. Okay, and the difference between the measurements should be between 3 to 5 centimeters, which hers is at 4, which is normal. Now I will begin auscultating. Okay, please take a deep breath in and out, in and out, in and out. Okay, breath sounds sound normal, no abnormal breath sounds. Okay, now I will check for egophony. Please say E.
E, 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 E.
Okay, I'm hearing muffled E sounds. Now we will do the whisper 1, 2, 3 test. Can you whisper 1, 2, 3, please? I'm hearing muffled 1, 2, 3, which is a normal finding. Okay, now we're gonna move on towards the anterior part. I'm inspecting and palpating for any tenderness or masses. Okay, now the chest expansion. Can you please take a deep breath in and out? Okay, symmetrical expansion. Now we're gonna percuss the anterior chest. And now I will auscultate. Take a deep breath in and out. All breath sounds sound normal.